Hello friends, today we will see one important topic, that is mediastinal lymph node stations. This is very important topic for those who are managing lung cancer patients. It's helpful for diagnosis of patient, to use whether to use TBNA needle or EBUS, which lymph node should be targeted, like that. It helpful for staging of lung cancer and also helpful for prognosis of lung cancer. So for all these purpose, we should know mediastinal lymph node stations. What are the lymph node stations involved and how to stage the lung cancer patients. So this video I have made in Hindi also, so you can check on my YouTube channel. So before proceeding to mediastinal lymph node, here three CT scan cuts are there. So you have to tell which is what CT cut section. So in this section, first one we can see beautifully, we can see lung parenchyma. So this is lung window of HRCT thorax. Okay. Second one is we cannot see lung window, but we can see mediastinal structure. But we cannot identify which is vessel, which is lymph node. So this is HRCT thorax with mediastinal window. And third one is you can see there are white structure, black structure. Okay, so this is contrast enhanced CT scan. This is mediastinal window of CECT thorax. So in that we used to give contrast, and this blood vessels used to take contrast and looks as a white structure. So by CT scan only we can differentiate between blood vessels and lymph node. So if you are going to see staging of lung cancer, or if you are going to see lymph node stations, you have to ask contrast CT for same purpose. Otherwise, you cannot differentiate in this HRCT, which is lymph node, which is blood vessel. So contrast CT is essential for lymph node stations. So why should we know about lymph node stations? As I told earlier, it is helpful for staging of lung cancer. So in subsequent slide, we'll see how to stage lung cancer like N1 node, N2 node, N3 nodes. Then another is to tell prognosis of lung cancer patient. If there is N3 node station involvement, it will be poor prognosis. If N1 stage is involved, this is less severe patients or less means better prognosis. So for prognosis purpose. For other disease other than lung cancer like sarcoidosis, tuberculosis, where involvement of mediastinal lymph node is there, so in those patients we have to identify which station is involving, and after treatment whether lymph node that regressing or not. For follow-up purpose we should know lymph node stations for these patients also, like sarcoidosis or tuberculosis. So how many lymph nodes are there? As I told you, there are 14 stations of lymph node in mediastinum. Okay, so N1 nodes, it starts from station 10, goes to up to 14. So 10 to 14 is station 10 to 14 is N1 nodes. So you might be reading in your lung cancer guideline. So N1, N2, N3 less severe, and N3 is more severe. So N2 node is starts from 2 and extend up to 9. So station from 2 to 9 is N2 disease or N2 lymph node stations. N3 is most severe disease, poor prognosis, advanced cancer stage, involvement of station 1. So if any patient who has station 1 lymph node positive, it means already N3 node is positive. It means poor prognosis. No need to identify these nodes once you find station 1. So how to identify these stations? Let's see one by one. So these are the 14 stations. So it starts from upper part of trachea, means neck. In neck, this is neck, this is sternum. Upper border sternum is called suprasternal notch. So how to remember these lymph node stations? You go from neck up to diaphragm. So go like this, from up to down, like this. Okay. Then come here in mid one and just goes from medial to lateral like this, like Hanumanji. So go from above to downwards, then go from medial to lateral side. This is how we have to map our lymph nodes. So just above clavicle, there are supraclavicular node, above sternum, suprasternal node, and here is lower cervical. So this is station 1. Okay, so station 1 is lower cervical, supraclavicle, and sternal notch. This is supraclavicular, this is suprasternal notch, and lower cervical. So to identify station 1, we doesn't require bronchoscope. It is superficial, extrathoracic, outside the lung area, outside the thoracic cavity. So mere examination by ultrasound or just palpation, we can identify station 1. And you know, station 1 is N3 disease, advanced cancer. Okay, so to diagnose advanced cancer, no need for bronchoscopy if lymph node station 1 is present. Okay, so below lymph node station 1, there is trachea. Here is trachea. Along trachea, 3 stations are there. Okay, how many? 3 stations. So upper trachea, lower trachea, mid trachea. Okay, like that we are remembering. So upper trachea is upper paratracheal lymph node. That is station 2. Right side 2R, left side 2L. Okay. Lower paratracheal 4R, 4L. Lower paratracheal right side 4R, left side is 4L. So another station 3, it is not along the trachea, but it is anterior to trachea or posterior to trachea. If it is anterior to trachea, this is called prevascular. Why it is called prevascular? Because in front of trachea there is blood vessels, which is superior vena cava. So any lymph node anterior to superior vena cava, it is prevascular. In front of vessels, prevascular. So trachea, before trachea is superior vena cava, and in front of superior vena cava, this is prevascular. Here you can see, here is prevascular. So this is just behind sternum. So also called retrosternal, just behind sternum. Just behind retrosternum is 3A, and behind that is vena cava, then trachea. So this is 3A. Just posterior to trachea, antitrachea is 3A. Posterior to trachea is 3P. That is retrotracheal. This is trachea. You can see here trachea. And posterior to trachea is retrotracheal. Retrotracheal, behind the trachea. This is 3A and 3P. And lower part of trachea is lower paratracheal, 4R and 4L. So one thing I have to tell you that this is trachea. That lateral border of trachea or left side, this is left side lateral border of trachea. You have to mark very carefully, because right side of this border is right side lymph node. Left side of this border is left side lymph node. So how to differentiate right and left tracheal nodes? By marking lateral border of left side of trachea, left part of trachea. It is not like a midline. It's not like a midline, and midline, right to midline is R, on left to midline is left. It is not like that. The margin is here, lateral border of left side of trachea. You have to remember. So far we have seen 4 tracheal nodes. Remember, 4 tracheal nodes, 4 lymph node stations. Station 1, station 2 upper paratracheal, station 4 lower paratracheal, station 3 is anterior to trachea prevascular, posterior to trachea posttracheal lymph node. 4 stations we have completed. Now fifth station lies along the aorta. So in trachea, left part, in middle part of trachea and left side, there is arch of aorta, and below arch of aorta there is pulmonary artery. So lymph node station 5 and 6 lies along the aorta, related to aorta. How to see? So this is arch of aorta. Okay. So the lymph node which is there along the aorta. This is arch of aorta. Along the aorta is lymph node station 6, also called para-aortic lymph node. Okay, so para-aortic means lymph node along the arch of aorta. In CT scan, if you find arch of aorta, then anterior to arch of aorta is lymph node is station 6. Is clear? Okay. So below arch of aorta, there is pulmonary artery. So lymph node between arch of aorta and pulmonary artery is called station 5, also called subaortic lymph node. Subaortic means below the aorta. Previously, it is called aortopulmonary window, AP window, but correct term is subaortic lymph node. Station 5 is subaortic lymph node, just below the arch of aorta. Then our trachea is finished. Lymph node 6 is finished. Now, when trachea bifurcates, then station 7 come. So 7 just below carina. And then after subcarinal, there is esophagus, because trachea has been completed, it's bifurcated, trachea finish. Then esophagus there in posterior part. So along the esophagus, lymph node 8 or paraesophageal lymph node below carina. Then near the diaphragm, there is pulmonary ligament. So lymph node along the pulmonary ligament is lymph node 9 or pulmonary ligament lymph node. This is how lymph node map from 1 to 9 along the central airway. In center 1 to 9. Then from bifurcation of trachea or hilum, go from medial to lateral side. That is station 10. 10 is hilar lymph node. Okay. Then 11. 11 is interlobar. Then 12, 13, 14. Lower, sub segmental, then subsegmental. This is how we are seeing lymph node from 10 to 14. So 10 to 14 is N1 node. If you find any lymph node from here, it is N1. If you find any lymph node from 2 to 9 is N2 node. If you find station 1, it is N3. Poor prognosis, finish. Okay, so this is how we should remember lymph node from 1 to 14. Okay, now let's see our lymph node one by one. So coming to station 1, as I told you, station 1 is lower cervical, supraclavicular, sternal notch. This is clavicle. So above clavicle is lymph node station 1. This is suprasternal notch. Okay, station 1, lower cervical. So it is extrathoracic, outside the thoracic area. This is station 1. Okay, this is station 1, extrathoracic. No need for bronchoscope. By examining ultrasound or just palpation, you can identify station 1. In this CT scan, you can see this is station 1. Okay, so station 1 is completed. Now station 2. Station 2 is called upper paratracheal lymph node. Means the upper part of trachea. The lymph node lying along the upper paratracheal area is called upper paratracheal lymph node. So you can see this is trachea from here to here, upper part. So how to define upper part? How to differentiate from upper part to lower part? Okay. So in right side, you can see this is brachiocephalic vein. Can you see this blue one? Brachiocephalic vein. When this brachiocephalic vein is crossing from right to left, this crossing mark between upper paratracheal and lower paratracheal in right side. Okay. If I say right side, it means this is along the lateral border of left side of trachea. So anything right to this margin is right side. Anything left to this margin is called left side. Okay. So how to differentiate between upper paratracheal and lower paratracheal? In right side, when this brachiocephalic vein cross from right to left side. In CT scan, you know how to identify brachiocephalic vein. Then only you can differentiate between upper paratracheal and lower paratracheal. In left side, from sternal notch to the upper border of aortic arch. This is aortic arch. Can you see this aortic arch? So anything between sternal notch and aorta, this is upper paratracheal. And along the aortic arch, this is lower paratracheal. Okay, so this is lower paratracheal. So in CT scan, you can see this is apex of lungs, apex of thoracic cavity, that is sternal notch. So it extend from here up to, this is, what is this white structure? White structure is subclavian vein, sorry, brachiocephalic vein. So when brachiocephalic vein crosses from right to left in center, then this is the margin, this is a cutoff for upper and lower. So upper paratracheal extend from apex of thoracic cavity to the brachiocephalic vein when it crosses from right to left in right side, in left side up to upper border of aortic arch. This is upper paratracheal lymph node. So in this diagram you can see this is brachiocephalic vein. So brachiocephalic vein, at the brachiocephalic vein and above brachiocephalic vein is 2R, and 2L is up to upper border of aortic arch. Okay, so in this CT scan you can see, so you can see this is trachea, upper part of trachea. Why upper part of trachea? Because you can see this branches of arch of aorta. Okay, common carotid and subclavian artery. Okay, so this is along the upper paratrachea. This is 2R or right upper paratracheal. Here it is left upper paratracheal, 2L. Okay, so this is upper paratracheal, right and left. Now coming to station 3, that is prevascular and prevertebral, anterior to trachea and posterior to trachea. So you can see this is sternum. Okay, so this is trachea. So in front of trachea is superior vena cava. Okay, so in front of superior vena cava is 3A, that is prevascular. So also called retrosternal because just posterior to sternum. This is 3A. And prevertebral means this is trachea, this is esophagus. So posterior to trachea and esophagus is 3P or prevertebral. This is vertebrae just anterior to vertebrae. This is prevertebral or posterior lymph node, 3P. Okay, so 3A is anterior to the vessel and 3B is behind the esophagus, which lies prevertebrally. That's also called prevertebral lymph node. This is station 3. Okay, so let's see station 3A very carefully. Okay, so 3A means anterior to vessel, trachea. In front of trachea is vessel and in front of vessels. This is 3A. So right side it extends from anterior to the superior vena cava up to sternum. Okay, left side anterior to left carotid artery up to the sternum. So this is superior vena cava. Anterior to superior vena cava is 3A right side, and 3A left side is just in front of left carotid artery. From above to downward is extend from apex of the thoracic cavity to the lower border of carina. So this is apex and this is carina. Just trachea is bifurcating. Okay, so it starts from here in front of trachea. Okay, so this is start from apex to bifurcation. This is anterior part of trachea. This is prevascular, 3A. In this diagram, you can see this is arch of aorta, this is trachea. So in front of vessel, this one, not this one, this one. In front of vessel, this is 3A or prevascular or also called retrosternal, just behind the sternum. Now coming to 3P. 3P is posterior to trachea or posterior to esophagus, just in front of vertebral column. So you can see this is extend from apex to bifurcation of trachea, that is carina. Okay, posterior to trachea, in front of vertebrae. This is vertebrae. Can you see this vertebrae? In front of vertebrae, this is posterior or retrotracheal lymph node or prevertebral lymph node. So you can see this is trachea, this is vertebrae, and in between them, this is lymph node called 3P or prevertebral. Okay, this is prevertebral. So in this CT scan, you can identify this is arch of aorta, this is trachea, just behind the trachea, in front of vertebral column. This is vertebrae. So prevertebral or retrotracheal is, this node is 3P or posterior node, 3P. Okay, so this is 3P. Now coming to lower paratracheal. Lower paratracheal means the lymph node along the lower part of trachea. Okay, so as I told you that 2R is there up to the border where brachiocephalic vein crosses from right to left. So this is brachiocephalic vein, this wide one. Okay, so below this area is 4R or lower paratracheal. Okay, it extends up to carina. Okay, starts from brachiocephalic vein to carina. This is lower paratracheal. Okay, right side. In left side, it extends from upper border of arch of aorta to lower border of arch of aorta. Along the arch of aorta, if you finding arch of aorta, then right to arch of aorta is 4L. Okay, and what about margin? As I told you, along the left lateral border of trachea, this is 4R. Okay, so you can see here in this diagram, you can see this is trachea, this is arch of aorta, and this is subclavian vein. Okay, so below subclavian vein is 4R. Okay, so any lymph node is here, this would be 4L. Okay, in this CT scan, you can see this is brachiocephalic vein, this is 4R. Okay, 4R. And what about this node? This node, this is behind the trachea, this is 3P. Okay, so you can see 3P and 4R, lower paratracheal. Okay, now coming to station 5. Station 5 and 6 is related to arch of aorta and pulmonary artery. Okay, so lymph node between arch of aorta and pulmonary artery is station 5 or aortic lymph node, also called AP window. This is old name, AP window. Okay, so is extend from lower border of aortic arch and the lower margin by the upper border of left main pulmonary artery. Left main pulmonary artery. This is left main pulmonary artery and above is arch of aorta. Between them. So this is descending aorta. This is pulmonary artery and lymph node between two is station 5. So this is subaortic. Sorry, aortic lymph node. Okay, subaortic. Okay, so in this CT scan you can find this is ascending aorta, descending aorta. Once you find ascending aorta, descending aorta, it means arch of aorta is finished. You have come downwards from arch of aorta to downwards. So here arch of aorta is finished, so you can see this is ascending, this is ascending. Here is the pulmonary artery will get start. So the node between two aorta is called aortic lymph node or AP window, station 5. These are station 5. Okay. Now para-aortic, as name suggests, is along the arch of aorta. You can see arch of aorta. In this diagram, you can see this is arch of aorta. So lymph node along with the arch of aorta is para-aortic, and para-aortic is on the anterior to the aorta, not here. Is anterior to the aorta is para-aortic lymph node. So once you find arch of aorta in CT scan, then anterior to arch of aorta is para-aortic lymph node or station 6. So you can see here is station 6. This is arch of aorta. In front of arch aorta is station 6. Okay, so this is trachea. Here is 4R because lower paratracheal. Okay, so any lymph node if you find here, just left to trachea, this would be 4L. Okay, 4R, 4L, and this is lymph node station 6, para-aortic lymph node. Now our trachea is finished, and below trachea is bifurcation, that is carina. So lymph node below carina is subcarinal lymph node. Okay, this is carina. Okay, so below carina is subcarinal lymph node. Okay, station 7. Okay, it extends from carina to the lower border of bronchus intermedius. Okay, this is bronchus intermedius. So it extend up to here. So what is bronchus intermedius? There is common opening for middle lobe and lower lobe. So this is bronchus intermedius. The lower border of bronchus intermedius from carina to this is station 7. Okay, in left side it extend from carina to lower border of left main bronchus. This is left main bronchus. This is lower border of left main bronchus. So up to here the station is 7, right and left side. Okay, so it extend from carina to lower border of bronchus intermedius and left side lower border of left main bronchus. So you can see in this CT scan, this is carina, already trachea bifurcated, below which is station 7. Okay, this is subcarinal lymph node. This is very important lymph node. You should know how to identify, because this is the most common lymph node. You are going to take sample by your TBNA or EBUS. Another most common lymph node from where you are going to take sample is from 4R and sometimes 4L and 2R and sometimes 2L. So you cannot miss 2, 4, 7 and 10. These are the most common lymph nodes where you are going to take sampling by your bronchoscope. Okay. Now coming to 8. So below subcarinal lymph node, you can find paraesophageal, because trachea is finished here. Okay, bifurcated. So below trachea is there esophagus. Esophagus behind the trachea. Okay, so trachea is finished, but esophagus is there. So lymph node along the esophagus is called paraesophageal lymph node. It extends from subcarinal lymph node to the diaphragm, to the dome of diaphragm. Okay, so you can imagine that our bronchoscope going along the airway, so we cannot reach here. Okay, because once you insert your bronchoscope, it will go trachea, main bronchus here. You cannot go here. So this lymph node can be approached by EUS, endoscopic ultrasound only. Lymph node station 8. Okay, so in this diagram you can see this is heart. Long back the trachea is bifurcated. So this is paraesophageal lymph node. This is esophagus. Can you see this small hole? This is paraesophageal lymph node. We can assess with EUS only. Now station 9. Station 9 is pulmonary ligament lymph node. So this is lymph node along the pulmonary ligament. Upper border of station 9 is defined by inferior pulmonary vein and the lower border of the diaphragm. So here it is pulmonary ligament. This is just beside the paraesophageal lymph node. We'll see diagrams. Okay. So this is station 9. It is quite difficult to identify. Okay. Now coming to station 10. So up to 9 we have completed. We have completed from in straight line from upward to downwards. Now coming to medial to lateral side, like this, Hanumanji, like this. Okay. So when trachea is getting bifurcated and lateral to bifurcation starts station 10, that is hilum. What is hilum? Where left or right bronchi, pulmonary artery and where vein are getting started. Okay, so this is hilar lymph node. This is bifurcation of trachea. So anything lateral to bifurcation is station 10. So you can see this is carina, and lateral to carina is station 10. Here it is station 10. So station 10 can be started even before bifurcation in lateral side. We will see diagram afterwards. This is station 7. So station 10 is completed. Now station 11. So 11 is just just lateral to station 10, interlobar lymph node, interlobar between two lobes, not along the lobe, between two lobes, like between right upper lobe and bronchus intermediate. This is station 11R. Okay, then between middle lobe and lower lobe, this is station 11RI, intermediate. Okay, in left side between upper lobe and lower lobe, so this is 11L. Okay, interlobar lymph node. So in CT scan also you can see same thing. This is 11R, 11RI intermediate, and this is left R. This is 11. So 12, 13, 14, this is uh, again distal to carina, distal to 11. Okay, so 12 is adjacent to the lower bronchi, station 12, along the lower bronchi. Between bronchi is 11, between bronchi is station 11. Along the lower bronchi is station 12. So as right side has three lobes, so upper lobe is 12U, middle lobe is 12M, lower lobe is 12L. Station 13 is segmental, station 14 is subsegmental. So you should know how to identify from station 1 to station 14. These are very important lymph node station for lung cancer patient, for lung cancer patient purpose. So this is the CT scan cut, contrast CT. So you can mark the area straight line from first rib. This is first rib. So anterior to first rib is station 1. Station 1 is supraclavicular, suprasternal notch, and lower cervical. Okay. So just right to trachea is 2R. Here it would be 2L. And posterior to trachea is retrotracheal, behind the trachea, retrotracheal. So you can see station 1, station 2R, 2L, and 3P. 3P means retrotracheal. Okay. In this cut again, you can see here is first rib here. So in front of first rib is station 1, station 2R upper paratracheal, lower paratracheal, left side upper paratracheal, and this is 3P, retrotracheal. Okay, and you can see here lymph node is arising as 3A also in front of vessel. These are the vessel in front of vessel. The lymph node which is arising is 3A, pre-vascular. Okay, so in this diagram you can see station 1 area, station 3A, 2R upper paratracheal left side, and this is retrotracheal lymph node. Okay, so in this diagram you can see this arch of aorta is getting started. Okay, so I told you that once arch of aorta is seen, you can see the lymph node which is along the arch of aorta, in front of arch of aorta, anterior to arch of aorta, that is para-aortic lymph node. These are the para-aortic lymph node. Okay, then when arch of aorta is there, trachea is lower trachea. Okay, but I told you in right side the how to differentiate 2 and 4, 2R and 4R by brachiocephalic vein. You can see here it is brachiocephalic vein, but you can notice it is not crossed from right to left. There is no full arch. So the lymph node which is there along the brachiocephalic vein, it is 2R. This lymph node is 2R because brachiocephalic vein didn't cross the midline. Okay, but here in left side this is 4L. Why? Because arch of aorta can be seen. So lymph node along the trachea when arch of aorta is there is 4L. Okay, this is 4L. And behind the trachea is 3P, retrotracheal lymph node. So this border, left lateral border of trachea is demarcation for 4L and 4R, right side and left side. So this is 2R. Okay. So you can see now subclavian vein is, brachiocephalic vein, you can see very clearly this arch. Okay. So lymph node posterior to subclavian vein is 4R. Okay. 4R, lower paratracheal right side. Here it is along the arch of aorta is 4L, lower paratracheal left side. And along anterior to the arch of aorta is para-aortic, station 6. Behind the trachea is retrotracheal. And in front of trachea is prevascular. In front of vessels is prevascular, 3A. So 3A, 6, 4L, 3P, and 4R. So you can identify clearly. So how to differentiate 4R, how to demarcate 4R and 3P by 4R and 3P divided by the posterior border of trachea. Here is posterior border trachea. Anterior to this is 4R, posterior to this is 3P. Okay, so you should not forget this line, left border of left side of trachea. Okay, because it will change your staging. Is clear? Now you can see this is lower part of trachea. So lower part trachea, right side is 4R, here it is 4L, no problem. Here it is 3P's, no problem. And what about these nodes? So you can see arch aorta is not finished yet. It is not get completed. So, but it's going to completed. So this is transition node. So this is along the aorta, this node. So this is para-aortic. But this node, lower one, is sub-aortic lymph node because this is coming below arch of aorta. So this is very thin demarcation. But you should not worry because this is not going to change your staging of lung cancer. So this is para-aortic, this is sub-aortic. So this is para-aortic, this is sub-aortic. Okay, 4R, 4L, 3P, and 3A, right? So in this diagram, you can see now arch of aorta finished. Now this is lower trachea. Lower trachea right side is 4R. Here it is 4L. This is 3P. And what about these nodes? So these nodes are sub-aortic below the arch of aorta. Okay, these are sub-aortic AP window. Okay. So now in this diagram, you can see here it is lower part of trachea just above the carina. This is 4R, 4L, here is this 3P. And what about these nodes? This is pulmonary artery. This is ascending aorta. This is descending aorta. This is subaortic lymph node. Okay, subaortic lymph node. But one thing you should know that here lymph node station 10 is also coming. 10 is hilar lymph node. So trachea is about to bifurcate. So here the station 10 is also coming in picture. So this is very difficult to differentiate, but you have to learn how to differentiate between 5 and 10. So the lower border of pulmonary artery is cut off for station 5 and below 5 is 10. So inferior border of 4L, superior border of the left main pulmonary artery. Okay, so you have to identify the lower border of pulmonary artery is station 10, hilar lymph node. Now again bifurcation of trachea is coming. It's not bifurcated fully now. So again this is 4R, here it is 4L, but here it is station 10, hilum. Hilum is when pulmonary artery is getting in the lungs. So here pulmonary artery is getting in. This is 10. This is along the AP window, station 5. So here it is 3P because Kerna has not come yet. So above Kerna is 3P. Here it is 4R and here it is 10 because the right pulmonary artery is getting entered into the lungs. So in this picture, now Kerana has formed. This is right main bronchus, this is left main bronchus. Okay, so below Kerana is station 7. So very important, we have to identify station 7 just below Kerana. Okay, and along the hilum, this is station 10. Note adjacent to the main stem bronchus, here main stem bronchus, station 10. Here station 10, and more distal to station 10 is 11. So we have to identify station 10, 7, 10 and 11. Okay. Now station 7 just below carina, station 11. Okay. So station 7 is starting from carina and goes up to right side lower border of bronchus intermediate medius, left side lower border of left main bronchus. So if you see the left main bronchus, up to that the lymph node is station 7. Okay, so along the main bronchus, or lower bronchus, station 11. This is 11 between the two lower bronchus, station 11. So you should not forget to identify station 7, which is very important for your TBNA and EBUS. Here again station 7, but you can see that station 7 is getting completed and station 8 is coming in picture. This is paraesophageal. Okay, so station now 8 has come because the lower right side intermedius has completed. These are bronchi, upper bronchi, lower bronchi. So this is station 8, paraesophageal. It cannot be sampled by your EBUS or your by bronchoscope. It can be assessed by endoscopic ultrasound. This is station 11. So like that, we have to see lymph node stations 9. This along superior border of 9 inferior pulmonary vein along pulmonary ligament. Here it is somewhere pulmonary ligament. So just 8 and just lateral to 8 is station 9. 8 lateral station 9. So it will go up to diaphragm. The lower border of 8 is the diaphragm, up to diaphragm. Station 8 in middle, and lateral to 8 is station 9. That is pulmonary ligament. So this is up to now we have completed our station 1 to 14. How to identify in CT scan. This is quite complicated. So you have to practice, then you can, then you will find easily. So now let's see quiz. So this lymph node station, which is this lymph node station, so you can see this is upper paratracheal or lower paratracheal. This is upper paratracheal area. Why? Because aorta has not come in picture. Okay, so this is the branch of aortic arch. Okay, subclavian artery and common carotid. These are the branches of carotid, branches of arch aorta. This is upper paratracheal. So lymph node right side to the upper paratrachea is 2R. Okay, right side upper paratracheal lymph node. So this is the lymph node where we can take our TBNA by bronchoscope or EBUS. Now, so you can see this is lower paratrachea or upper paratrachea. This is lower paratrachea. Okay, why? Because aortic arch has been completed. Now bifurcation of aorta, division of aorta. This is ascending aorta, this is descending aorta. This is lower paratrachea. So right side to paratrachea is 4R and left side is 4L, and this one is 3P, post tracheal, and here it is which node? This is aortopulmonary window, station 5. Okay, so this is 4R. Here it is upper paratrachea. Okay, so upper paratrachea, this is vessels. Okay, common carotid and subclavian artery, and anterior to vessels is prevascular, 3A. This is station 3A, prevascular. Okay, here you can see this is arch aorta, this is pulmonary artery, this is node in aortopulmonary window. So this is station 5, AP window. So to summarize, so you have to remember these names from station 1 to station 14. So from station 1 starts from this neck, goes 1, 2, 3, 4 along the trachea, 5, 6 along the aorta, and then 7, 8, 9 in the lower border of up to diaphragm, lower border of trachea. Means when trachea finish and up to lower border of diaphragm. So 7, 8, 9. From medial to lateral in hilum, 10, 11, 12, 13, 14. So 10 is hilar lymph node, 11 is interlobar, then 12 is lower segmental, subsegmental. Okay. So this is how you have to remember. I know this is complicated topic, so you have to revise again and again. So if you like it, please like it, share with your friends, and if you're not subscribed to the channel, please subscribe it. So for pulmonary residents, I have made lot of video in both language, Hindi and English. So you can scan your this QR code. You will find more videos on pulmonary radiology, like how to see normal X-ray, abnormal X-ray, CT scan. So I have made videos, lot of videos in radiology, and for pulmonary resident also I have made the pulmonary procedures, how to insert chest tube, how to do pleural tapping, how to do bronchoscopy, thoracoscopy. These videos I have uploaded in both languages, Hindi and English. You can scan QR code and you can see very easily. So thank you with this video. See you in next video. Thank you very much.